My name is Rachel. I'm going to be your student nurse today. Could I get you to confirm your name and date of birth, please?
Christopher Earl Ranieri, 9/23/58.
Great. I'm just going to check that against your wristband here. Wonderful. Right person. So I'm going to be conducting a head-to-toe assessment on you. Does that sound okay?
Yes.
Great. I'm just going to go wash my hands. I would do this for 20 seconds. Come back. And then I'm just going to provide you some privacy. Bye, Becky. Alright, can I take a seat?
Yes.
Wonderful. Have you been experiencing any pain today?
Yes.
Alright, could you give me some details about that? Like, where are you experiencing it?
In my elbow.
Okay, and...
Particularly this elbow.
Okay, does that pain, is it pretty localized, or does it radiate anywhere else?
Normally it's just the elbow, but it can radiate out to the hands, particularly pain in the elbow, but also numbness, tingling in the bottom two fingers and even into the entire hand.
Okay, and can you describe this pain for me?
It can be sharp, searing pain, or it can be a dull pain. It could be a shooting pain down.
Okay, and when did this all start?
Years ago.
Okay, and it's been getting worse since then?
Yes.
Or, okay, and when you first experienced it, was there anything that brought it on, or do you know what caused it, or what do you think caused it?
I don't know what necessarily caused it, other than I've been told it's the ulnar nerve.
Okay, and so you've been experiencing it for a while, and have you sought treatment for it?
Yes.
And what treatment was recommended to you, or what have you been doing so far?
So far they just suggested pain meds. If it gets a little bit too intense, at this time we've stayed away from any type of operation or what have you.
Okay, and are you satisfied with that? Have you been experiencing, does that make it feel better?
It's made it feel a little bit better. I take the pain meds only when I really need it.
Okay, and did you take them today?
I've been taking them this week.
Okay, and does anything make your pain feel worse?
Yes. Bending the elbow.
Okay, that would make sense. Let's see. On a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain imaginable, where would you rate your pain?
On a high level, 6 or 7, normally somewhere around a 2, maybe 3.
Okay.
And it could be both elbows.
Okay. And does this inhibit in any way your ability to do your normal daily functions, or to do tasks that you would ordinarily be able to do?
In a severe pain, it can more or less immobilize or make the arm useless, or be extremely distracting with the pain.
Okay.
But normally it's just pain, and I just straighten the arm out.
All right. So thank you for letting me know. I'll pass this on to your doctor. All right. So for general impressions of this man, seems to be in generally good health, has good posture, good hygiene, dresses well. He seems to have a positive behavioral affect, is developmentally appropriate for his age, and seems to be in no obvious signs of distress. So I'm going to continue with the assessment. Baba, you got to go back there. So for now, I'm going to move on to assessing your face. So if I could get you to remove your glasses, that'd be great. All right, I would have gloves on, but I don't have gloves, COVID. I'm just going to assess your scalp. In each of these body systems that I'm going to be looking at, I'm looking for deformations, discolorations, drainage, contusions, any crepitus, abrasions, penetrations, punctures, pulsations, bruises, tenderness, instability, lacerations, swelling, scarring, all of asymmetry, all of those fun things, any odd movements. So I'm feeling through the scalp. I noticed like a little dent here. Is that anything I should be concerned about?
Injury I had when I was a baby, and they
Okay, but it hasn't been causing you pains recently?
No.
Alright, I'm looking through the hair for any lice or abnormal balding, and I don't notice anything. Alright, so now I'm just feeling his skin. It's warm, pink, normal, all good signs. Moving on to feeling the temporal pulse. +2, normal and regular. Alright, can I have you open your jaw, please? And close it. Alright, no clicking, T&J is good. And open your mouth against pressure. Go ahead and wiggle your jaw. Alright, that's good. And can I get you to smile? Frown? Squint your, squish your eyes together. Puff out your cheeks. And raise your eyebrows. The other one too? Okay, thank you. Alright, and then I'm gonna go ahead and have you close your eyes. I'm gonna touch your face, and I want you to tell me which side and what part of your face I'm touching, okay? Ready?
Left forehead. Right cheek. Right forehead. Left chin.
Great. Alright, so cranial nerves 5 and 7 are both operational. I'm gonna move on to an assessment of your eyes, so I'm just gonna be feeling the ocular orbits. Seems to be intact. I'm feeling the sinuses. Any pain there?
Nope.
Alright, so probably no sinus infections. I'm just gently pushing against the eyes. Normal squishiness, no glaucoma suspected. Alright, can I have you go ahead and look at me? So I'm expecting the sclera and the conjunctiva. Sclera is white, conjunctiva is pink. Everything looks good. Eyelids seem normal, not any particular droopiness. I want you to look just past my ear. Sorry, it's a bit bright. And then I want you to look at the tip of this, and I'm going to move it towards you and just keep focusing on it. Okay, so eyes are perla, meaning that the cranial nerve 2 is also operational. And then I want you to take a look at the tip of my pen. Don't move your head, but follow it with your eyes, okay? Alright, so cranial nerves 3, 4, and 6 are also intact. I'm going to go ahead and feel your nose. No pain there. Can I have you look up? And then just inspecting the nose. Alright, and can I have you occlude one nostril and breathe in and out of it? Same thing with the other side. Is it harder to breathe out of that side?
More blocked on that side.
But no, is it usually more blocked on that side, or?
Just sinus issues.
Okay, so I didn't see any septal deviation, so I'm not really concerned about that. Have you been experiencing any issues smelling recently?
No.
Alright, so cranial nerve, meow, meow. Cranial nerve 1 is intact as well. Alright, can I get... So, lips seem normal, good coloration, not overly dry. Mom, stop. It's not part of the assessment. Go ahead and stick your tongue out. Alright, and point it. And then have it move from side to side. Alright, so cranial nerve 12 is intact. And then go ahead and stick your tongue out again. I'm looking at the mucosa. It all looks good. Dentition's good. I noticed the cap up there. Can I have you lift your tongue up? Alright, sublingual space is also good. Noticing 2 crowns on this side. Otherwise, teeth and mucosa look good. And then can I have you stick out your tongue and say ah? Say ah a little more first one. Alright, good bilateral raising of the uvula. And can I have you swallow for me? Alright, cranial nerves 9 and 10 seem to be intact. Alright, so I'm going to move on to feeling for the lymph nodes. So I'm looking for any swelling of the lymph nodes, parotid, submandibular, sublingual, accessory. I'm not noticing any swellings. That's good. I'm now gonna go ahead and can you lift up your chin or high? Not noticing any tracheal deviation or jugular vein distension. Trachea seems to be in good alignment. I'm gonna go ahead. No subcutaneous emphysema. Can you shrug your shoulders for me? All right, and then turn your face towards my hand. Same on the other side. Great. So cranial nerve 11 is also intact. I'm gonna palpate his carotid pulse. Okay, +2 on that side. +2 on this side. Both are regular and normal rates and rhythms. And then I'm going to go ahead and auscultate with the bell his carotid pulses. Okay, I'm going to have you hold your breath. All right. I didn't notice any murmurs. All right, can I have you take off your shirt, please? So now I'm going to inspect the upper extremities and the torso. All seem to be in good nick. So can you feel that equally?
Yes.
All right, so now I'm just going to be feeling CMS in both extremities. Bilateral pulses are normal, regular, and +3 strength, so pretty good. Can I have you turn your hands over? I'm just going to be looking at capillary refill. It should be less than 2 seconds. And it is in all fingers. Can I have you wiggle your fingers, roll your elbows, roll your wrists, and then move your elbows. Alright, so motion seems to be good, and keep your eyes closed. Which finger am I touching?
Left thumb.
And which finger am I touching?
Right index, or right pinky.
Alright, there you go. Yes, that's correct. And then can I go ahead and have you squeeze my hands? Alright, strength is good bilaterally. You can let go now. And then I'm going to have you push against my hands. Good. And then pull. Good. And then have your hands extended in front of you and close your eyes. So here I'm looking for drift, signs of stroke. They seem to be pretty equal. It's pretty good. Alright, you're good job. You can put your hands down there. And then I'm looking at the chest. I'm looking for, go ahead and take a deep breath for me. Alright, so there's good bilateral expansion of your back. Good bilateral expansion of the chest. So now I'm going to go ahead and listen to the heart sounds. So I'm listening to the aortic valve, pulmonic valve, tricuspid valve, and mitral valve. I'm listening with the diaphragm first for just general sounds, and then the bell for any murmurs, and I'll do that in reverse order. Alright, so going to second intercostal space. S2 should be stronger here, and it is. S2 is also stronger here. S1 is stronger here, and S1 is also stronger there. Then listening for murmurs. Alright. All of that sounded normal. Good rate rhythm. Alright, so now I'm going to be listening to your breathing. Go ahead and lean forward a little bit for me. And go ahead and breathe in deeply. And exhale. Breathe in. Okay. In. And again. Again. Go ahead. And again. Alright, go ahead and lift your arms, please. All right, deep breath. And deep breath. All right, lung sounds are clear in all fields. I'm gonna have you go ahead and lay down now. All right, so now I'm looking at the abdomen. The order of things I do is reversed. It's now inspect, auscultate, percuss, and then palpate. So abdomen looks normal, nothing out of the ordinary, as per mentioned. So I'm gonna go ahead and ask you a few questions. Start with, have you experienced any stomach pains recently?
No.
When was the last time you ate?
A few hours ago.
Okay, and have you, when was the last time you had a bowel movement?
This afternoon.
Okay, and have you experienced any pain or discomfort with urination?
No.
Alright, so now I'm going to move on to listening. I'm going to be listening starting in the right lower quadrant and then move counterclockwise. I'm going to be listening in 2 points per quadrant. So I'm listening medially and then laterally. Bowel signs should be between 5 to 30 per minute. Right? Bowel sounds are frequent but not hyperactive, so that's good. I'm going to move on to palpation. If you feel any pain, please let me know. I'm going to start with the lower left quadrant and move, what is that, counterclockwise?
Mm-hmm.
Yeah. So I'm going to do some light palpations. I'm looking for any guarding, rigidity, and the other things I've mentioned. Alright, that all felt alright, no pain? Alright, so then I'm going to do some deeper palpations. Alright, no pain there?
No.
Alright, and then I'm just going to do a rebound tenderness test. That didn't hurt?
No.
Alright, so that's also good. So now I'm going to be moving on to lower extremities. So I'm looking at the legs. I'm not noticing any asymmetry between them. Nothing, no lacerations. So everything looks good. I'm going to be feeling. You feel this equally?
Yes.
All right. So now I'm going to be feeling pedal pulses. They're pretty strong actually. I'd say +3. A good rate and rhythm. Hi, Pat. You little diva. I'm gonna go ahead and check your cap refill in each toe. Alright, cap refill is good, less than 2 seconds. I'm going to go ahead and have you wiggle your toes, please. And can you roll your ankles? Alright, so motion's good in both. And which toe am I touching?
Left big toe.
And which toe am I touching?
Right little toe.
Alright, and can I get you to push against my hands? And then pull against my hands. Great, and then I want you to lift up. Alright, good job. And I don't know any edema in either of the feet. Alright, can I get you to move yourself here? Alright, feel alright?
Yes.
Alright, so the next part, I'm just going to test, you can put your shirt back on. And then I'm going to be testing balance. Mom, stop. So you can go ahead and stand up. So now I'm going to be testing some balance with you. So I want you to walk to the edge of the bed, heel toe, so like this. You can use me for stability if you need, but try to do it on your own. Great job. Alright, you can stop there. Face me. And then go ahead and put your feet together. And then close your eyes and stand like that for 20 seconds. This is known as Romberg's test. If you were to fall during it, or, I mean, hopefully he'd open his eyes, but I would know that his balance isn't good, requiring further testing. Alright, so that looks good. Alright, so thank you very much. That concludes the head-to-toe assessment. Thank you for your time. Everything seemed normal, nothing to be too concerned about.
Thank you.
Alright, and that's